I love radio and I particularly like um, public radio. And just yesterday I heard on public radio that radio is becoming popular again. Audio is becoming popular again. And I was really happy to hear that. I'm not much of a TV person. I don't own a television. I really don't watch television. Once in a blue moon, I'll watch a movie on YouTube or on Amazon Prime with my hubby, but I'm not a TV person, but I do like to listen to the radio for about an hour, when they have discussions and things like that. And today was one of those days, and the discussion was about dementia and Alzheimer's. And there were a few scientists on the panel for discussion, and they were talking about how drug companies are having to go back to the drawing board with regards to doing research regarding drugs for Alzheimer's and dementia, because science and research has proven that these drugs that these pharmaceutical companies have come out with over the past several years have done pretty much nothing to get rid of or really to help Alzheimer's and dementia patients in any way that is of significance. So the question was, should pharmaceutical companies find other ways to invest their money, or should they keep pursuing this finding a drug to treat Alzheimer's patients, dementia patients, so that they can see any significant result? And the consensus was half of the people said they felt that they should direct their money elsewhere, because so far no drug has proven to be effective in helping to reverse or to stop the progression of dementia in any way. Now, I know, based on my healthcare experience, my almost 30 years of nursing, I have noticed that there is a significant rise in the number of people that are diagnosed with dementia, and they're being diagnosed at an earlier age than normal. I remember when I started seeing dementia patients, they were probably in their 70s, but I'm noticing now 50s. I'm seeing dementia patients, okay, and dementia and Alzheimer's. And I'm not a scientist, as it were, but based on my observation, what I see is that most of these people have other chronic health conditions. And so I have personally come to the conclusion that it is our lifestyle that has led to Alzheimer's and dementia, just like how it is our lifestyle that leads to heart disease. It is our lifestyle that leads to blood pressure problems, diabetes, high cholesterol, kidney disease, or lifestyles that lead to digestive disorders and lung disorders. Lifestyle, poor nutrition, a lack or insufficient exercise, a lot of stress, insufficient sleep and rest and relaxation. So, an overall lack of caring for ourselves. We're so busy caring for the job, caring for other people, we don't spend much time, if any, caring for ourselves. Now, this morning I was talking to a business colleague of mine, and she shared with me that her very good friend has breast cancer and was having chemo, and that she herself had had cancer. And I shared with her that I have a very good friend who was diagnosed with stage 4 breast cancer related to stage 4 lung cancer, and that my friend told me that she changed the way she eats, cut out meat, dairy, and all flesh, has incorporated a plant-based diet, and also has been juicing greens and other things, and also has been drinking that combination of blackstrap molasses, baking soda, and apple cider vinegar. No, I had told my friend about this some years ago, and she always said it was just too nasty tasting, she couldn't use it. But she told me that a Chinese lady told her son that that is what he should be giving to his mom. And this is her testimony. She said to me, ever since I started eating better and started using the apple cider vinegar, blackstrap molasses, and baking soda every day, she told me that she's now able to walk outside and to get her little chores done in her house. Now, I saw her a few months ago, and when I went to visit her, she was barely able to walk, to hold on to the furniture and get around a little bit from the bathroom to the living room and to the kitchen to get a little water. And she told me last week that she is walking outside around the block. Now, to me, that's significant improvement. And she tells me that she knows it's because she's changed her way of eating. She has embraced a plant-based diet and incorporated the apple cider vinegar, blackstrap molasses, and baking soda every day. Now, what that concoction does is to help to bring our body out of an out of an acidic state into a more alkaline state. And I believe I did mention in another video that that's what healed me of most of my menopause symptoms. When I was having a lot of hot flashes, I went on a blackstrap molasses, apple cider vinegar, and baking soda regimen, and I did 14 days on, 14 days off, 14 days on, 14 days off, and I don't get hot flashes anymore. Also, I also switched to a plant-based diet in 2012 when I was very, very sick, and I have absolutely no health issues at all right now, and hasn't for quite a while. Now, diet is very important. Our food is our medicine, and our medicine is our food. And in the discussion today, it was mentioned about a research about the people who live in the blue zone, and how the people who live in the blue zone have more centenarians, meaning people who live to be 100 or more, and are functional people than anywhere else in the world. Now, I never heard about this blue zone study, and there was actually a book written, they say, about this blue zone study. Essentially, a gentleman decided that he wanted to do a research to see why certain places in the world have more centenarians and overall healthy people than the rest of the world. And some of these places were specific area in Italy, Costa Rica, Loma Linda, California, Greece, Japan, and to name a few. I think there were 7 such places they named as blue zone. And here are some of the common denominators among these centenarians. They were primarily plant-based eaters. They ate beans every single day, and that's why I'm showing you these beautiful lentil beans. Okay, that's one of my favorite beans. It's cheap and it's loaded with all kinds of nutrients. So one of the common denominator among these blue zone people who live healthily well into their 100s, still functional, still cook and all of that, is because one reason is because they all eat beans every single day. The three most popular beans are lentils, chickpeas, and also I think I saw one with black eyed peas. But really, I don't think it matters. Whatever your favorite beans and peas are, eat it every day, essentially, is what it's saying. Most of them eat sweet potatoes every day, like a half a sweet potato. They eat green vegetables every day. They do not eat dairy. Those that do drink milk, they drink sheep milk and goat milk. They eat goat milk cheese or sheep milk cheese, like in Greece and those places. Also, I read or heard that they drink teas a lot, herbal teas, including fennel teas, chamomile teas, green teas. You know, those folks in Japan, they're into the teas. So the herbal teas, the rosemary tea, those kind of teas every single day. They also drink a lot of water. And I also read that they all will have 1 cup of coffee. Not a lot of coffee, 1 cup of coffee, except the ones in Loma Linda, California. That group, they're Adventists and they don't believe in drinking caffeine and also wine. Another common factor I heard or read about these blue zone people is that they'll have 1 to 2 glasses of wine per day. And also, these people were very social. They were into family and friends and their social life, so they weren't lonely. That's another thing. They also walked a lot. They didn't drive or take bus if they could walk. So they walked a lot. They rested quite a bit. Okay? So but the bottom line is that they all are they make an effort to incorporate a healthy lifestyle as part of their norm, and that includes not having much flesh. I read that these blue zone people, when they did have flesh, they would have goat meat or fish, and they didn't have it every day. They would have eggs no more than 3 times a week, and they would have small portion of fish, like 3 to 4 times a week, or small portion of goat meat 3 to 4 times a week. So they weren't eating flesh every day. Their main diet was plant-based. I believe the Adventists, they have oatmeal every morning for breakfast. And you know, I was talking a couple days ago to my hubby, and I was telling him that my mom, who is 83 years old, she's never really been a plant, like say a vegetarian of any kind. My mom always ate meat every day, but small portion of meat. Couldn't afford to buy a lot of meat. And when they were children, and my grandparents or so, they didn't have a refrigerator, so you couldn't buy a lot of meat anyway, even if you could afford it. My adopted dad is 85, in his right mind, does his own business, his own cooking, laundry, hand washing his clothes, clean, takes care of his bills and everything at 85. He'll be 86 in February. And he too is not a plant-based eater. He does eat meat, but one fish will last him 3 to 4 days because he'll cut it in 3 pieces or 4 pieces. So he's eating small portions of flesh and mainly roots, pumpkin, potato, boniato, squashes, corn, and some fruits when the fruits are in season. But my dad always goes to bed at 9 and he gets up at 6 every morning, and he does take a nap in the afternoon. So lifestyle determines how healthy, and wealthy too, because health is wealth. Lifestyle determines how healthy we are overall. And when I say health, I mean any brain health, stroke, dementia, Parkinson's, cardiac diseases, breathing problems, bronchitis, emphysema, that kind of thing, digestive disorders, urinary disorders, skin disorders. Lifestyle determines whether or not we'll be afflicted by any of these. And so if we make a concerted effort to eat well, exercise moderately, walking is man's best medicine. Okay? Get adequate sleep at night. Don't listen to anybody who tells you that 5 hours of sleep at night is adequate. It is not. It absolutely is not. I say one needs a minimum of 7 to 8 good hours of sleep per night. And if you can on your days off, get a little nap in the afternoon. Get some fresh air and go walk wherever you can walk to. Don't drive or take the bus. Walk. And incorporate some exercise. Walking is quite fine. 30 minutes, 3 to 4 days a week. That is excellent. At work, if you can take the stairs or during your lunch break, take a walk around the building. That is very, very healthy also. Make friends. Say hello to people. Smile. Make friends. Call up family members and check on them and chit chat. Read. Go to your place of worship or get involved in some social group. That also helps for a healthy, overall healthy life, healthy body, healthy mind. Okay? Remember, if you do not take care of yourself, who will? And drugs are not the answer. Drugs do not cure anybody. Drugs do not heal anybody. Our food is our medicine. Our food, if we give our body the right tools, great plant-based food mainly, even if you have a little meat, don't have much and don't have it every day. Okay? Sugar is another thing that they said the blue zone people hardly touch. They're not into sugar. So you won't see them eating a cookie much or muffins and that kind of thing. Okay, overall healthy, and they drink a lot of water, and you won't find them drinking soda and juices. So remember, take care of yourself, and yourself will take care of you. God bless you, and take care.